Hello guys, so this is going to be the third part of our this series. So in this we will be further discussing some important questions that are relevant for RRB. So let's move to our first question. It says which of the following factors can significantly influence blood urea nitrogen levels in dialysis patients? So the option 1 here says room temperature, option B says age of patient, option 3 says time of day test is performed, and option 4 says recent high protein intake and hydration. So out of these four options, which can which factor can significantly influence blood urea nitrogen? So the answer will be blood urea nitrogen rises after high protein intake and dehydration. It falls with overhydration or poor protein intake. So the answer will be fourth. Moving to the next question, it says management of anemia in dialysis patients. So how we are going to manage anemia in dialysis patients? So the first option says we can increase dialysis duration. Option B says by the help of vitamin B12. Option C says start corticosteroids for red blood cell production, and option 4 or option D says administer ESA and iron. So we all know to in order to manage anemia in patients, we often give patients erythropoietic stimulating agents and also some iron supplements, and they helps treating anemia because in CKD patients, what we see is that kidneys are unable to produce erythropoietin on their own, and that's why they are mainly anemic. Moving next, the question says purpose of blood leak detector. So we all know there is a component embedded in the dialysis machines and we call it blood leak detector. So what is the major purpose of that particular device? So the option 1 says regulating dialysate temperature, option B says detect blood in dialysate outflow, option C says ensure adequate ultrafiltration, and option D says monitor BP during dialysis. So the main role of blood leak detector here will be to detect blood in dialysate outflow. If the dialyzer membrane rupture, blood may leak into dialysate, and that device or that detector alerts the staff immediately to prevent further blood loss into the dialysate. Moving ahead, next question says why might patients on peritoneal dialysis require increased dose of insulin or blood glucose lowering therapies? So why the patients who are on peritoneal dialysis, we have to provide them higher doses of insulin or blood glucose lowering therapy? So the first option or the first statement here is because dialysis remove insulin from the blood. Option second says because peritoneal dialysis decreases blood glucose level. Option 3 says due to insulin resistance and glucose absorption from hypertonic dialysate, and option 4 says due to decreased appetite and weight loss. So the first option here is wrong because dialysis does not remove insulin. Option second says because peritoneal dialysate decreases blood glucose levels. That is also false statement. Though peritoneal dialysate increases blood glucose level because PD fluids contain glucose that is absorbed into the blood. This glucose is there because in order to achieve that osmotic gradient through which we are going to conduct a peritoneal dialysis treatment. So yeah, this raises blood sugar and increases insulin requirement. So the answer will be due to insulin resistance and glucose absorption from hypertonic dialysate. This will be our right answer. Moving ahead, this question is based on vascular access. It says preferred first line AV fistula site. So what will be the preferred first AV fistula site in a patient? So first option is brachiobasilic transposition. Option second is radiocephalic at wrist. Option 3 is forearm graft, and option 4 is axilloaxillary graft. So everybody I guess know radiocephalic is the first choice for an AV fistula in a patient, and that too in a non-dominant hand. So, uh, radiocephalic at rest, this is distal site, preserves future access options and has lower complication rates. It is the first choice for AV fistula cannulation. Moving ahead, the question is why blood urea nitrogen test done in dialysis patients? So why we have to do one test in dialysis patients? Option 1 is to assess liver function. Option second is to evaluate kidney function and dialysis effectiveness. Option third says to monitor glucose levels, and option 4 is to measure electrolyte balance. So we conduct one test to evaluate kidney function and dialysis effectiveness. One reflects urea levels in the blood. It helps assess renal failure severity and adequacy of dialysis. Example, URR and KT by V. Moving ahead, the next question is which of the following is a key feature of contemporary cycler machines used in automated peritoneal dialysis? So, what will be the key feature of the cycler machines, contemporary cycler machines that are present in the automated peritoneal dialysis? So, option 1 says only one preset exchange time. Second is manual control of flow rates during dialysis. Well, this is not going to be answer since it is automated peritoneal dialysis. Option 3 here is use of hydraulic pumps to deliver solution, and option 4 is gravity dependent solution delivery. So the answer will be third, the use of hydraulic pumps to deliver solution. Modern APD cyclers are automated pumping systems to control fill, dwell and drain accurately. They are not gravity dependent, so the fourth option is also incorrect. They are not gravity dependent and allow programmable exchange overnight. So this will be the answer. Moving ahead to the 28th question, it says what is the primary consequence of excess recirculation during hemodialysis? So if there is excess recirculation while we are performing dialysis, hemodialysis in patients, so what are the uh, consequences that we are going to figure see in the patients? So option A says decreased dialysis time. Option 2 says overestimation of urea reduction ratio and single pool KT by V. Option 3 says increased urea removal, and option 4 says improved dialysis adequacy. So decreased dialysis time, that can happen, but not in every case, because generally dialysis time does not decrease when there is excess recirculation. It only happens when there is some sort of problem with the flow and we have to cut off the dialysis time, because either it is going to be the set will be clotted and the patient will suffer further blood loss too. In that particular case, we have to decrease the dialysis time. Second option says overestimation of urea reduction ratio and SPK2V. Yeah, this is the right option, because same blood will be moving again and again from that particular area, and we are going to calculate that. Option third says increase urea removal. Now that is not going to be the case, because the blood that is we are measuring, or that the dialyzer is circulating, will be same, so urea removal will be decreasing. Fourth option says improve dialysis adequacy. It is also going to be decrease, it not going to be improved. So the right option is second option, and it says recirculation means already dialyzed blood re-enters the dialyzer, giving false high urea clearance readings. This makes the dialysis adequacy appears to be better than it is actual. So particularly we are going to overestimate everything. Moving ahead, the 29th question, it says a 36-year patient with lupus on dialysis has AV graft failure. Biopsy shows thrombosis. Lab investigation should show suspected what? Option A is antiphospholipid syndrome. Option second is uremia. Option 3 is lupus nephritis. And option 4 is nephrotic syndrome. So what will the lab investigation showing? The answer is antiphospholipid syndrome. APS shows hypercoagulability and recurrent thrombosis, including AV graft clotting. It is common in lupus patient and should be evaluated with antiphospholipid antibodies. Moving ahead, 30th question. Which of the following is the drug of choice for ventricular fibrillation in cardiac arrest situation? So, what will be our first line drug of choice? So the answer will be amiodarone. After defibrillation attempts in ventricular fibrillation, pulseless amiodarone is recommended in advanced cardiac protocols since it helps stabilize cardiac rhythm when shock alone is insufficient. So whenever there is ventricular fibrillation or cardiac arrest situation, amiodarone is our first choice or a primary drug of choice. So this was all about in this video. Hope these questions going to help you in your examination. Make sure to like this video. Thank you.